Hey everyone, welcome back to another episode of A Bright Idea Podcast, a show where I sit down with entrepreneurs to discuss the aha moments that launched their businesses. If you're new here, I'm Amber Key, your host. Thank you for listening. If you're in the car or maybe you're out running errands, I just want to let you guys know that A Bright Idea Podcast is also available on YouTube, so if you'd like to watch this conversation, please check out the video version online. Today, we will be hearing from Rebecca Caesar, founder of Tinted Health, a first-of-its-kind platform built to place healthcare consumers in the driver's seat when it comes to representation. Rebecca and her co-founder listen and understand that people want to have access to providers that look like them and work within their communities. Placing an importance on diversity without sacrificing care, all of their providers and listed partners through the Tinted Health platform have taken cultural literacy and sensitivity training to ensure that the service and care provided is a top-tier experience. Rebecca has over 15 years of strategic healthcare operations experience. She graduated undergrad from the University of Massachusetts Amherst, where she has a degree in kinesiology, and shortly after completing her master's in healthcare administration from Regis College, and then completed her Doctor of Health Sciences degree in healthcare systems management in fall of 2022. This girl's busy. She has worked in multiple specialty operations and outpatient practices, spearheading workflow optimization and process improvement. She is committed to health transformation and opportunities for accessible, high-quality care for all. She has been quoted that being a minority within the healthcare space has made me look at what compassion and safe healthcare truly looks like. All too often, minorities have varied experiences within the healthcare system, differing from their counterparts. And a core reason for this is because the lack of diversity among decision makers, accessibility, and education. I am in a position to be that change agent, and that is why I created Tinted Health. This conversation is imperative. As a Black woman and someone who has had varied experiences in doctor's offices, there is no better time than now to have this conversation and fill the void that so many people go through as patients and as providers in the healthcare industry. I think that this conversation is going to help so many people. The fact that there is going to be a platform that's not like Google or ZocDoc or some of the other directory services out there where you have to scour for hours and hours to find a provider that looks like you. This platform was created for Black and Brown providers and for Black and Brown patients to find people in one central location that looks like them and have also been trained in cultural sensitivity, among other ways of learning about who their patients are, that you can't find anywhere else. So I'm extremely excited for this episode. So in this episode, Rebecca and I discuss her journey climbing the corporate ladder in healthcare administration, her frustration with being one of the only Black people, Black women at the table looking to create change, and the moment she decided that it was time to walk away and finally create a platform that she and her co-founder believe are going to fulfill the needs of Black and Brown patients and providers. As always, don't forget to subscribe to the podcast and follow us on Instagram at A Bright Idea Podcast for behind the scenes content and updates. And if you're enjoying this show, leave us a review. It really helps us spread the word. Let's get into this episode. Thank you so much for joining A Bright Idea Podcast today. How are you doing?
I'm good. Thank you.
I'm super excited for this conversation. I think that it's a really important one to have about diversity and inclusion in the healthcare space. We'll get into it in the episode, but I am so excited that there is a platform that's sort of one of a kind that really puts the consumers or like the patients in the driver's seat of like what representation means in the healthcare industry. You and I have talked a little bit prior to this interview just on your background in the space, what you were seeing, and really being a trailblazer for making change. And so I am so excited for the listeners here today that whether they are part of the Black and Brown community or not, I think this is an incredible conversation to be had. And so I'm just excited you could be here today.
Yeah, thank you so much for having me on. I'm looking forward to telling you more about our platform, what it is that we're building. But I agree that this is an important conversation to be had, and I'm happy to provide any context and information around the
So
topic.
before we get into Tinted Health today, which is your platform that you founded, I want our listeners to take a step back and learn a little bit about you, who you are outside of being a founder, and how did you kind of get into this industry. So I will start by asking you, like, can you talk to us a little bit about your childhood, and like if your parents were on this show today, like how would they have described you as a kid?
Yeah, so happy to give you a little bit of context. I would say that I was definitely, I wouldn't say a loner, but I was an only child for a good amount of time. And I really just enjoyed playing a lot with my cousins and connecting with like family. And I would say like growing up, like my family was all in the healthcare space. So early on, I understood what that meant and what that represented. My mom's a nurse, my sister's a nurse practitioner, my aunt's a respiratory therapist. So I have like family that's diverse in the healthcare industry that have kind of had a varied background across the healthcare space. So I knew early on that I wanted to go into healthcare. Initially, I thought that I would be on the caregiver side of it just because that's kind of what I grew up around. And like, I am like a nurturer. So I think like I'm always kind of like making sure that
Mm-hmm.
everybody's okay. So I gravitated more towards that. But I would say that during my formative years and just kind of pivoting and like going into my undergraduate program, I really started being more intrigued about like management and the background layers of healthcare and how it kind of works behind the scenes. Because at first I was like, okay, I'm going to go into being a physical therapist. And I learned early on that I actually was much better suited for the management side of things. So, spreadsheets, data management, working with like health pairs and systems, and just really understanding the behind the scenes work that goes into what makes a healthcare organization function is really what I started to gravitate towards. So, um, that's really what propelled me to kind of take more of an entrepreneurial route in looking into healthcare. And I really worked my way up. I've worked in varied capacities within healthcare, from the administrative side as a receptionist, and then a case manager. And then after getting my master's in health systems management, I pivoted more to managerial roles, administrators and senior leaders and directors. And my most recent role was as an executive vice president for a pediatric company, like overseeing
Yeah.
multiple practices. So I've been on the inpatient, meaning the hospital side, and the outpatient side, private practice, like understanding the intricacies of running a healthcare organization and helping from the merger and acquisition side, how to make health systems more effective. And that's really like what I gravitated towards was
Yeah.
healthcare operations. And I noticed that there was a need in the field, and I ended up pivoting towards entrepreneurship.
I remember when you and I were on the phone, you had talked about wanting to become a doctor. And like many people that I talked to who thought they were going to go into the doctor realm, you were like, I took organic chem, and I was like, okay, this may not be the path for me. And so I want to get into how you found yourself in the administrative and also sort of the business side of the industry. How did you find that you were good in that area, and sort of how did you guide yourself in that way?
Yeah, so early on, one of my first roles from leaving undergrad was working at a skilled nursing facility, which was also a rehab clinic. And again, I said my path was to become a doctor, and that kind of pivoted like early on. So I did move into
Mm-hmm.
physical sciences, and I was pursuing the physical therapy route, and I ended up getting a job that was essentially on that track. And at that clinic, I quickly started involving myself not just in the therapies that I was working on with the other therapists, but doing some of the administrative work behind the scenes. So, doing a lot of the verifications with the insurance companies, like going into the patient charts and understanding proper billing and coding procedures, and helping the executive director of that clinic, like on an administrative capacity, like just shadowing her at meetings. Helping her just really keep the center organized. And she quickly like recognized in me a skill set in terms of management. She was like, "Oh, you're actually kind of good at this." She's like, "Are you sure you want to just treat patients?" She's like, "Not trying to steer you away, but I think like you'd also be really good at like the executive management track. So she essentially like took me under her wing, and I call her my mentor because she did guide me to going back into the master's program for health administration. And I stayed with them for the earlier parts of my master's degree. But then I knew I needed to actually get a management role in order to be able to take that path and go and excel and be able to take on roles that were going to be more aligned with a health administration track. So she wrote me my letters of recommendation. She kind of prepped me for my next role, and she helped secure my first management position in health administration and healthcare, and like operating an entire health division for physicians in a clinic. And that was like huge. And that's what kind of propelled my trajectory into working in that managerial space. And if it wasn't for her, I probably would have stayed. I probably would have been a physical therapist, to be honest, because I had no desire at the time to look at becoming an executive health leader. I was like, I just want to take care of patients and go home at the end of the day.
I'm curious, when you were climbing that ladder, and it kind of ties into how you founded Tinted Health, like were there conversations surrounding diversity and inclusion, and what was sort of your experience being a Black woman in this sort of position, that you were seeing that later on you felt like there was a hole that needed to be filled?
So to be honest, when I first started out in this career path, like I didn't necessarily recognize that there was a void. I didn't necessarily see that there were pockets or areas that were like, I would say like areas of opportunity to be able to fill that void. And then slowly, as I started climbing up the ladder and taking on larger roles like director roles and executive director roles, I recognized that I was the only one sitting at the table that looked like me. I just didn't realize it in the beginning because I've been fortunate where I have had really, to the surprise, white men who have kind of really cultivated and built up my career. So like when you see, you know, I would say like Caucasian people who are your allies in a sense, like that are like seeing something in you and wanting you to succeed, specifically in white men, I would say, you don't really start to see that discrepancy until you're in other rooms. And I would say that when I started transitioning, I would say maybe 6.5 years ago, I started really recognizing like, okay, why am I the only one here? Like, I know I can't be the only person that knows this much or has taken this path. And like oftentimes you see that the career ladder just kind of stops when it comes to other minorities in the space, whether they didn't get the mentorship or whatever the case may be, but you just don't see a cultivation of really trying to bring other thoughts and leaders into the space. And I specifically during COVID, for me, that's really when I had like the aha moment per se, where I just felt like there was a shift. Like I was an executive director overseeing the entire New York region for fertility practices and really working to bring on more books of business and um, really surrounded by an entirely Caucasian team and being the only minority leader there. But then you also see patients that look like you, and you don't see a representation across the spectrum to one, address their needs, or even a level of understanding to like bring that cultural aspect to healthcare. And even the teams that I was working with really weren't that diverse. And a specific incident that comes to mind for me was when we were filling out paperwork for a grant. And they specifically were asking on the paperwork, like one of the questions was, what percentage of your workforce is diverse? Because I guess they like to give the grants out to like diverse workforces. And they were really trying to understand like the overall minority mix. And I couldn't answer the question. Like I couldn't even, it was like, to me, it was like more like a jarring moment. Like, okay, wow, like we have less than 4% of our organization that's actually reflective of what they're asking. So that was like one moment in the heightened state. But then also like they came out with a new ruling in terms of the diversification in healthcare and how health plans were now going to start offering affordable options for fertility for everyone across the board. Not every payer, but like certain insurance companies were basically providing ways to be able to create a family in the fertility space. And it brought up conversations in the workplace that I just quite frankly wasn't comfortable with, because I felt like the voices around me didn't understand the significance of what this ruling meant and how we should be triaging and helping patients that didn't necessarily come from the typical background of patients or affluence that they were seeing within the space, because typically fertility is a cash-based business. So now that it's, you're now getting a more diverse subset because of this ruling, it started bringing about different attitudes and voices. And COVID was happening around the same time, so you started seeing communities of color being disproportionately affected, in the sense that they were being treated and just worse health outcomes overall. So for me, I felt like, okay, like, I'm tired of being a passive voice at this table, because I was finding it increasingly difficult to, one, diversify the physicians that we are bringing into the group, finding a pathway for patients to feel representation on a whole, especially since I'm not the one treating the patients. And how can I like truly make an impact? And even for myself, I was just like, there's not enough variety when it comes to the type of providers that I want access to. So myself and my co-founder were like, you know what? It's time to, like, what are we missing? Like, what's the problem? And for us, it always went back to accessibility, finding easy access to providers of color. And how are these providers being educated? Like, why do they just not understand that there is a disconnect, or there is a challenge or a barrier when it comes to cultural nuances within healthcare? And we wanted to solve for that.
So the pushback that you were getting, there were several layers to this issue. And so you were speaking up at the table of like what some of these like disparities were, right? And they weren't listening to you, or there was just like a lack of understanding altogether?
Yeah, so I wouldn't so much frame it as pushback. I would just say there was really just a conversational gap where it was as if like talking to a brick wall. So it's like, I think it's hard to recognize the privileges that you're afforded when you've always been in the privileged state. That's just really what it is. So like when you're trying to tell someone, or like teams, like, yeah, no, we need to diversify the physician workforce so that we can meet the subsect of the entire population, it's kind of like, well, why? Well, why do we need to do this when, we should just be choosing the people that we feel are qualified? But I'm like, okay, so if you're saying you need to choose the people who are qualified, in the same breath, are you saying that people that look like me are disqualified? So it's like, I just think like the attitudes around the conversation just were lacking. Like, they didn't understand the importance of really bringing a more diverse workforce to the organization. And not only that, it wasn't just at the provider level, it was even within like the office staff level. Like, I think it shows value not only to the patients and just overall treatment, and the way that you treat patients and their treatment protocols and the way that they adhere to things, to show that they're understood. And there was just a communication barrier, not only for myself as an executive leader, but it was like, okay, like, now am I filling a quota, or do you actually want to start adopting the ideas that I'm bringing to the table? So because I felt like there was just constant like friction and a bottleneck to be able to create change, I was like, I'm going to do it myself. Like, I'm going to create a space where not only do I feel heard, but you can see the representation around the table. And I think that's where it starts. It starts at the top. And if you don't have an executive team, quite frankly, that's representative of the whole, you tend to have more singular ideas and approaches.
All right, guys, can I get a little personal with you real quick? A few months ago, I turned 30 years old. The big 3-0. My whole life, I've loved birthdays. I love big parties and new memories with friends and family and opportunities. I never really thought about the number or what the next year could look like until this year, when something about turning 30 stopped me in my tracks, and I decided it was time to get a little serious. I started to reevaluate a lot of things in my life. What I wanted to do with my time, what I wanted to achieve in my personal life, what kind of woman I wanted to become. And I thought to myself, one of the first things I need to do is get my money right. Gratefully, I grew up in a household where we had conversations about money around the dinner table. Discussions about the stock market, debt, 401k, financial independence. No topic was off limits. I thought I was in a good place managing my own money until I started planning my future, and I had no clue where to begin. This made me turn to a financial advisor. Working with a financial advisor has been an enlightening journey that has brought me incredible value in more ways than I initially anticipated. Having a dedicated advisor taught me a discipline around finances that I hadn't experienced before, challenging me to prioritize my goals and align my spending with what truly matters. I've also come to better appreciate the worth of my time, realizing that how I spend both my time and my money directly impacts my long-term success. One of the most empowering aspects of working with a financial advisor has been learning strategies and techniques to make my money work for me. These are concepts that we just don't learn in school. From tax optimization to investment strategies and retirement planning, I've gained insights that I could have never developed on my own. Having someone guide me through complex financial decisions has been far more beneficial than trying to handle everything myself. With a financial advisor's expertise, I've been able to approach financial independence with clarity and confidence, knowing that I have a trusted partner who understands my aspirations and can help me make informed choices. Chosen Advisory Group caters to the ambitious, the established mid-career professionals, and those on the cusp of retirement who recognize the dedication required to attain financial independence. With their experience and clear professional guidance, you can transform your financial goals into a reality. Life is stressful. Money should not be. Begin your journey to financial clarity. You can schedule your complimentary consultation at www.chosenadvisorygroup.com today. During the years of COVID, when there was sort of this emphasis on diversity and inclusion and bringing more representation to the table, and with a role like yours, where there's not very many people that look like you, and so you sort of have this opportunity to change the landscape in this corporate setting. First of all, that's a lot of pressure. But secondly, at what was the breaking point that you were like, okay, I could do this and make some huge change in the healthcare system, or I could go off and do this on my own? Like, I could imagine, climbing the ladder, you had sort of this idea of what your life and your career would be on this corporate side. And why, like, can you tell me that exact moment that you were like, forget this, I'm going to go do this myself?
Yeah, so I think it's that answer. It's multi-layered. So I think oftentimes being a Black woman, especially a younger Black woman, like generationally, that's been able to be successful at the table. And I'm not attributing that just to my own successes. There are people who have helped cultivate me along the way. But I think when you are a Black woman and you are passionate about certain things and topics, it can also be viewed as like aggressive. And that I was tired of that narrative of being able to propel my voice to be able to create change, but it's also viewed as being obstinate, because unless you agree with the majority, then you're viewed as being combative or difficult, and because you don't want to go down the right side per se. So I feel like that was a constant struggle where it's like my views and my ideas and the things that got me so far within my career, you notice there's a stopgap. Like you almost hit the glass ceiling because people really just want you to assimilate. And I've never been one to just fit within a box, and I refused to just be cast into that. I didn't expect myself to climb so far to just be stopped. So I felt like my potential, my overall growth was just really I hit the glass ceiling, quite frankly, and I was like, I don't really want to be associated with teams or organizations that don't want to foster collaboration and growth. So for me, that was ultimately like the breaking point where I was like, you know what? Why am I fighting so hard for my voice to be heard at a table where it never had a chance of succeeding, to be honest, to begin with? So I felt like, what's stopping me? I have all the tools now in my belt. Like I did the educational path. I kind of went down that road. I have a wonderful network under my belt. So like I feel like I have the tools to be able to venture out on my own and take a risk. And I feel like because I've been able to get so far in my career, like I felt more comfortable saying like, you know what, I can take the risks now because I always have a plan B, which is my corporate career. No worries. So yeah, like that's really what changed it for me. It was just like having my voice repeatedly silenced, and being forced to try to assimilate to a model of care and leadership that really didn't align with my core values and my beliefs, and really wanting to dismantle it and find a way that I could create it on my own and have people sitting beside me who aligned with the same ideals, and really wanted to breathe, eat, and sleep diversification within
So take me
healthcare.
to that moment, and I don't know if this was for you, but I am a really big visualization person. Like I have to have the vision for it. I have to have the notebook. Like take me to that moment where you were like, okay, this is Tinted Health. This is the inspiration of it, and this is what it aims to do.
Yeah, so Tinted Health has had like multiple ideation phases. So it wasn't like a light bulb that just kind of like went off in my head, but I knew there were a few things that I was trying to solve, but the reality is you can't solve for everything. So I really had to understand, what is it that I'm really trying to create, and why is this the idea, the concept. So for me, it really just boiled down to, I'm tired of walking in spaces where I don't really see a lot of minority providers in that space. I'm tired of being like seeing that one token Black physician or like that one Indian provider. I just wanted it to be easy. For me, like, again, like another like catalyst where I was like, this has to be the idea. I went to a dermatology appointment back in 2020 because I had gotten into an accident where like fire like burnt my skin. Luckily I'm okay, but the dermatologist was trying to prescribe me, a white dermatologist was trying to prescribe me a cream that I knew was going to do the opposite of what they were trying to tell me. But because they were like, oh, no, 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 you just have to use a little bit here and do it sparingly, I'm like, no, you're telling me to use something where clearly I have pigmented skin, it's going to cause a negative side effect, but you basically wanted to say try it and wait and see. So for me, that was just kind of frustrating. It was experiences like that where just being dismissed completely, and I was like, okay, I need to create a world or a space where people that look like me feel safe within healthcare. Because like it was to the point where it's like, I'm sitting at the corporate ladder, I don't feel safe at the table of people that I sit with, I don't feel safe going to be seen by the doctors that are supposed to make me feel safe, and I also don't feel heard. And I felt like this was a constant battle, and we, pulled many people across the country and got like other voices to the table to be like, am I crazy? Is it just me? Am I the only one seeing this? Is this even a world where something like this could exist? And it was like overwhelming support. So I knew that I wanted to solve for diversification within the healthcare space, not only because I came from that world, but because I didn't see it myself. I didn't see it from the patient side of things. And then also understanding the education piece, like why is it so hard? Like why are Black people dying? Like why do like women have higher mortality when it comes
Yeah.
to giving birth? Like why is it harder for, patients in general of color to be able to be diagnosed earlier on for diabetes or high cholesterol? Like I really was trying to understand these questions, and for me it boiled down to education and that cultural competency piece, where understanding the socioeconomic and demographic
Yep.
differences between a Caucasian patient and like a minority patient, and understanding why when we go to the doctor, it's almost dismissive versus when someone else goes into the doctor and they complain about the same thing or they have issues in the same area, but they're being heard. So for me, I was like, okay, accessibility and education, that's the aha. We need providers who actually want to help solve this problem and make it a better and a safer, psychologically safe place for minority patients. And we also need to be able to create a space where people like you and I can easily find a provider in real time without having the burden or the stress of having to find someone to listen to them for their individual care needs.
One of the things that when I was doing research on your platform that I found to be very interesting and so important to the bigger scope is that you take your providers through a cultural literacy sensitivity training. Talk to us a little bit about that and then the impact that it has on the patient experience.
Yeah, so we are still super early in our platform. We have our product fully built out, and now we're in the path of recruitment, hiring physicians to come work with us and work for us. So the education piece is critical. It's really an asynchronous model where the providers can take this education on their own. We've curated the courses. We partnered with a third party platform where we've come up with a bundle of 13 courses that have various undertones for the providers, whether it may be understanding their own internal bias when it comes to medicine, or questions that they should be asking specific of color to make sure that they're giving them the same opportunity to ask the right questions and be heard. It's a multitude of things, or like how to educate your staff
Mm-hmm.
and them more aware of their surroundings, offering a translator if necessary. So I'm just giving you some of what the courses entail. And once the providers have taken this course, they're now certified in it. And every 2 years, they need to recertify to make sure that their knowledge base is active and it's current. So for us, that was like critical. And in terms of the overall patient impact, we know that patients are more likely to adhere to what a doctor says if they trust them.
Right.
So it's all about relatability and that bridging that gap when it comes to giving patients a safe space to be heard. If you're judging a patient or not listening to their concerns or not asking those right quick questions, they're less likely to follow the instructions that you give them.
Mm-hmm.
So for us, it's really about changing that relationship between the patient and the provider so that we can say we are making a larger impact from like that clinical standpoint, to say like, okay, because we have patients now that are trusting the physicians within our network, that now translates to them going to the ED less, taking their medications more. We've been able to lower the incidence of this disease. These patients are reporting more favorable outcomes, and they go to the PCP more now for annual visits or regular checkups instead of going to urgent care. So we're still in the early phases of like really being able to measure and quantify our impact, but we know that this is the right first step to take so that we can start actually taking the data from the patients that are going to be utilizing our platform and understanding from a clinical level from the providers what that overall span of that reach will look like once we're done and launching in the marketplace.
I think that that's incredible work. And I think that you touched on such a point that's so important, in that people do trust the information that doctors give. And so I think especially in the Black community, we have a lot of issues, and a lot of times we don't go to the doctor. And sometimes that's because we go to the doctor, they tell us one thing, we go home, it doesn't work, and then we stop going to the doctor altogether. But I think that through this education and through this training, the sensitivity training that you're giving the providers, it does build that trust, so that, to your point, we continue to take our medications, to go to the PCP, to adhere to some of these things that they're telling us. I think that I haven't heard that before, that people are doing that with their platforms, or just in the healthcare industry in general. So I think that the fact that you guys are thinking of that so early on is so important. And I want to know, how does your platform empower patients to find providers that reflect their communities and cultural backgrounds?
Yeah, so within our platform, we have certain algorithms that are built. So patients go on our platform, search through multiple modalities, whether it's language, they filter like they're looking for a provider that went to an HBCU. Like there's multiple ways
That's
to
awesome.
filter. We're also incorporating feature with, instead of going onto a website and looking for thousands or hundreds of doctors, they have to read through all these bios based on their symptoms or the subset of data that they're looking for. We can narrow that down to the top 5. So it's like, okay, on like what you put in, look at these physician profiles more to see if there's a match. And then if they can find one within that shorter, simplified list of providers, then that makes the healthcare experience much easier for them to be able to navigate through our platform. So we're really trying to make it more, we have first, our interface is completely user friendly. Like we've made sure that we built it from the patient standpoint to understand like what it is that they would want and things that they would need. But then we also incorporated these features where patients can now find a relatable provider. And something else that we've done, which is different, when you go on these websites to look for a doctor, all you see usually is a smiling profile. You don't know anything about the doctor. So we've incorporated a way to interview the providers in advance. So on their bios, there's a video intro of each provider that essentially says, this is who I am, this is what I do, this is how I practice medicine. This is why you should pick me as a doctor. And it's more of a like a welcome, inviting approach right out the gate. So they're like, oh, okay, I really like the vibe of this whole provider, and I'd like to actually book an appointment with them. So we really kind of changed the way that we're incorporating ways to get patients involved and choosing the provider of choice.
For consumers that are interested in using this platform that may say, how is this different than a ZocDoc or a Better Health, where you can not customize, I'm not sure of the word right now, but find a doctor that is of your specialty, of like whatever service that you're looking for and looks like you. What do you say to that?
The biggest differentiator is that we're flipping the healthcare paradigm on its head, meaning you will find the majority of our providers will be minority providers versus the latter, where you're finding more Caucasian providers on the platform. So we're creating a space where patients can essentially go on and focus solely on primary care. So we're not at a space now where we're open to having specialists or other providers. It's only in the primary care space. But as we continue to grow, we will definitely be adding other specialties to our platform as well.
This is great. So I know that you have not launched yet, but what is sort of the feedback that you're getting so far?
Yeah, so I think from the provider lens, they're really excited to partner with us because they believe in the mission and the cause, which is like creating a safe space for minority patients to go on and be able to access care quickly and be able to interact with providers. Another cool thing about our platform is that we have a integrated patient portal where the patient can talk directly to the provider versus talking to their staff. So like if you want to upload, like if you're like, oh, I have a rash, can I like make an appointment to see you? You can send that directly to the provider. They can look at it, assess it, and get back to you versus you waiting to hear back from the office staff or having to make a phone call. So we're really trying to make it patient friendly. And the early adopters that we let utilize our platform from the patient standpoint, they're like, oh my God, like I love this. Like this is easy for me to use. I can get all my information and my notes all in one place. I can download my results in real time. I can talk to my providers. So I think like it's a space where I think patients feel like it's more of a community versus going to like just to go see the doctor. It doesn't really feel like you're doing something health related, even though you are. So it's more of like building that family relationship where it's like, okay, like this is somebody that I want to go back to see over and over and over again because they're feeling safer in the way that they're seeking care.
Girl, you are working hard on this platform. And I just hearing your passion about it and all of the work that's going on behind the scenes. Like, what, as a founder and as someone who has studied systems as well, like, what are some of the challenges that you're experiencing building out this platform? And what are you doing to overcome them?
Yeah, so with any founder, I'm sure with any entrepreneur will say it takes a village. It's not easy. Having people on your team that are brilliant and understand what it is that you're building is paramount. Not in taking it all on my own shoulders, but also like knowing how the power of delegation and leaning on your team for support is huge. And then also like networking. I think that that's like critical. Like I try to get as much FaceTime as I can with anybody and everyone who's willing to listen to what it is that we're building, connecting with like investors or other founders or health leaders or thought leaders in the space, just so anybody who can hear my message, if they can bring that to somebody else, then I already did my job. So I feel like building that insular community around what we're doing and like leaning on my team is what's really helping us to achieve those milestones day by day. And 2025, we're excited for our launch so that we can bring this to the masses and people can start utilizing our platform and giving us additional real-time feedback. So I would just say it's not easy. Take it a day at a time. Self-care is incredibly important at this stage because every day feels like you're putting out a fire, but because our platform is mission driven, that belief in what we're doing is what constantly fuels us in knowing that every day there may be challenges, but we're doing it for the greater good.
What are some future plans and developments that you have in mind for the platform? And are there any like features or expansions that we should look forward to?
Yeah, I think like our goal right now is to start partnering B2B, so working with employers so we can offer our network to their employees so that they can seek out access to care through our platform. We're working on getting ourselves credentialed with insurance companies so that we can start accepting insurance directly through our platform so that patients don't have to worry about paying for any services through us. They can just put their insurance information in and we'll bill the insurance company directly. So those are some of the things that we're, working on. And then also always constant tech and feature iterations to try to enhance our platform and make the overall user experience more seamless. So we're constantly developing and ideating and looking for ways to go to market and make sure that we're taking in that customer user interface into consideration as we continue to build out our platform.
And how do you see Tinted Health contributing to the broader conversation of diversity and inclusion in the healthcare industry?
Yeah, so in a perfect world, because of our platform, we're honestly looking to try to drive a mandate where every medical school teaches physicians about cultural competency. It's a shame that some schools don't even have it on their docket and they're, cultivating and bringing physicians into the workforce in droves, but they're just missing that piece and what brings fostering that collaboration and community for patients of color. And I think that what our platform also does, it also brings the conversation to the forefront because the fight for health equality is far from over. We're just starting to tap into it. And I think that platforms like myself have a larger place and a piece to fill in that void because I see like right now, like there's a lot of platforms that are focused on like one specific area or like you hear like, oh my God, like it isn't until there's a fire in one area that everybody wants to rally around it. But how about we start being more preventative and proactive instead of reactive? And I think that that's what our platform is going to start doing to change the conversation and the way that providers practice medicine, quite frankly.
What has been, I feel like you are a young Black woman in this healthcare space, and like you've done so much in your career so far. Like, what for you has been the most rewarding aspect of creating this platform and the focus on elevating providers of color?
The most rewarding, I think it's really the people that I've been able to meet on this journey, to be honest. Like, I don't think I would have been in the rooms that I've been in if I wasn't a founder or an entrepreneur. I think being a founder and entrepreneur, it gives you almost like this Dora the Explorer complex where like you kind of have to peel the layers back and start being more investigative and putting yourself in spaces and circles that you probably wouldn't think to lean or tap into before. And I think that for me, that's been the most rewarding. I've been able to meet so many brilliant minds throughout this process and people who are innovative and not even just in healthcare, but just in terms of business and strategy and understanding what it is that I'm going to need and what systems I'm going to need to build and put in place in order for this platform to be successful. And I think like if there's anything that I've learned, it's be more open. Don't be afraid to ask for the things that you need. Put yourselves in rooms and spaces that you might not necessarily be comfortable navigating, but those are where you're going to find the most fruitful and thoughtful conversations and be connected to people that can essentially change your life. And I think that that for me has been a profound experience. And I think being able to pay it forward eventually is something that I look forward to.
What does success look like for you?
The outside of the being able to retire early and sitting on a beach, but no.
Amen.
Yeah. Success for me looks like paving a generation of healthcare leaders that looks like me, being able to create a space where it's easier for women, specifically minority women, to be able to hold space at tables that weren't necessarily built for them, but they're still able to hold that space and have their voices heard. I think success for me overall in Tinted Health is being able to change a million lives. Like that's really our part of our mission is like within a 5-year span, we want to transform a million lives. So like I think we have a large calling. Success would be achieving that patient goal for the business, and then professional success is being able to honestly transform and change the landscape for minority women who are looking to succeed in business and in their corporate career ladder, to be able to know that they can create change just being themselves and trying to push for the ideas that and the thoughts that are important, so they can have a voice and be a player, a strategic player at the table.
We started this conversation with you telling us a little bit about your background and growing up in a family that work in healthcare. I'm curious what your family thinks of you and what they think of what you're doing to better healthcare for Black and brown people, and just like your overall experience.
Yeah, so I would say, like, in a nutshell, I think my family is definitely proud. I don't think they fully understand what I'm doing yet, to be quite honest, especially being a first generation, like American, like citizen, and my parents are immigrants and coming over. I think for them it's different. So like we have different ideals of what success is and what that looks like. So for them, like being an entrepreneur and venturing out and taking this risk, they're like, okay, maybe you should take us. They think it's scary. They're like, you're doing something for them that's really uncharted. But I think overall, like, they're proud to see that I'm not giving up, and like my passion that fuels me, and like I know that there's something brighter and bigger on the other side. And I think like just them seeing my overall journey from like the progression throughout my career and education, and like how I like articulate myself and the way that I'm like yearning to help other people, I think they'd be incredibly happy and proud. And I know they only want the best for this platform and for me to succeed professionally and personally. So yeah, like I think they'd be happy, and they do support me in many capacities. So I'm grateful for my family and the circle that I have around me.
That's awesome. Well, I'm inspired by you. I'm moved by this story. I'm rooting you on. And I think that anyone listening to this episode today is going to want to be a part of it. So, how can they be a part of it when they launch, and how can they support Tinted Health?
Yes, so join our newsletter. You can reach out to me directly at support at tintedhealth.com. And I answer my emails personally, and I'm happy to connect with anybody. Sign up for our subscriber list so that you can be the first to know what's happening with the platform, how we can engage. If there's something that you need, or if you're looking for a provider, like that's the best way to start getting involved. And yeah, like I think that that's the key. And people can also connect with me on LinkedIn, and they can, my profile is Rebecca Caesar, and you'll be able to find me on that avenue, on that platform as well, through that avenue. But yeah, like email the platform, join the subscriber list, connect with me through that way. Also, sending me a message is the best way if there's anything that you'd like to learn more about Tinted Health. But I'm happy to be a resource and an ally for those that want to join and learn more information.
This was great. Rebecca, thank you so much for taking the time to talk to us about your background and what you're doing with Tinted Health, and how you are changing the landscape of the healthcare industry for Black and brown people. So I appreciate your time today.
Yeah, thank you so much. I appreciate it. And I appreciate you bringing me onto this platform and giving me the forum to share more. But yes, thank you so much. And I appreciate the viewers and the people who are going to get to see this.
That's it for this week's episode of A Bright Idea podcast. Today's guest was Rebecca Caesar, founder of Tinted Health. If you're interested in being one of the early subscribers of this platform, you can sign up for their newsletter by going to their website, tintedhealth.com. You can also follow Tinted Health on all social media platforms. If you enjoyed today's episode, don't forget to subscribe and leave us a review. Your feedback really helps us bring more stories like Rebecca's. Be sure to follow us on Instagram at A Bright Idea Podcast for updates. And if there's a topic or a guest you'd like to hear from, drop us a message. And as always, thank you for listening, and keep pushing your bright ideas forward. Until next time, I'm Amber Key.